Operation Smile South Africa will perform corrective cleft lip surgeries to 23 children at the Nelson Mandela Academic Hospital in Mthatha between the 21st and the 23rd of October. Now, a group of 20 operative Smile volunteers, which include plastic and reconstructive surgeons, paediatricians, speech therapists and psychosocial specialists, will work with staff from the hospital to ensure the success of these operations. The hospital mostly caters for the rural communities surrounding Mthatha, who often feel they are neglected. Our reporter Nkululeko Nyembezi and video journalist Vincent Mtebele are on the story for us and join us now. Thank you so much for your time, Nkululeko. Please tell us more about this cleft corrective surgery.
Thank you very much, policy and the viewers at home. Of course, we are coming live from Nelson Mandela Academic Hospital. You'll remember that we are talking here about 23 children that will go home smiling. You'll remember that this area here, our town, but this municipality area, it's where most of the people or most of the kids have defects, put that way. But now I'm joined by the director of Smile South Africa, Operation Smile South Africa, Director Sarah Scaff. Ma'am, thank you so much for joining us. For sure, this is a beautiful initiative that you are doing. Can you just maybe tell us more about it?
Yeah, we are delighted to have been invited here by the Nelson Mandela Academic Hospital and the Eastern Cape Department of Health to partner with them to help those children, and there's one adult as well, who have been born with a cleft lip or palate. And over the last 2 days, we have had a team of volunteers, all South Africans, who have been giving their time, their expertise, their talent to be able to help these children. We are very excited about this partnership, but not only to help these children, but also to help build capacity, to transfer those skills to the local doctors here, so that in the future they will be able to help these children born with this cleft lip and palate.
So do you provide maybe this job for free, or what's the procedure if maybe someone in the rural areas have got children or kids that have defects, what should they do?
Yes, it's highly specialized surgery, and so Operation Smile is a global NGO which provides free, safe surgery, and we work in partnership with governments, with hospitals, and with local donors. And we have supporters around the country that have come alongside us to give us the funding so that the surgery can be provided at no cost.
Let's talk about maybe a reaction from the families after changing the lives of the people in this manner. For sure, it must be amazing.
It's life-changing. It really is. You can imagine as a mother, when your child is born, it's already a very stressful situation, and now to have a special needs child. Where do you go? What do you do? And so we want to make sure that for those mothers, that stress is minimized and that they know that their children can be helped, that they can live an absolutely normal life. This condition, it can be repaired. It's very specialized surgery, but it is entirely repairable, and it will be totally transformed or transform the child's life. But without the surgery, the impact is very negative, developmentally, speech, and many children die because they cannot feed properly. So it's very important that we are able to help these children so that, they can live completely healthy, happy lives.
Indeed, they can live a completely happy life. That was Sarah Scaff, who's the director of Operation Smile South Africa. But now I'm joined by the MEC for Health in the Eastern Cape, Mama Mthatha. Mama, for sure, you are really happy about what is going on here. There are a lot of young people who have got these conditions in the rural areas. For sure, you must be very excited.
Good morning to you and the viewers at home. Actually, being happy is an understatement. I'm just over the moon about this very important partnership with Operation Smile, which is not only coming here to change lives, put smile, but also save lives of the young ones, and making sure that we destigmatize the issue of the cleft lip and cleft palate, because in our society, once there is that particular issue. It's just a lip that needs to be repaired, and we don't take it that it's repairable. So we appreciate the partnership. Indeed, what we said at the beginning of this year, that working together with our partners, we can provide, protect, promote the healthcare service to our people. So we are very excited with this, in particular with the fact that we've got only few plastic surgeons. Actually, we've got only one plastic surgeon who is a specialist in our eastern part of the Eastern Cape. But still, he's not even that specialized, as you heard from Sarah, that this is a very highly specialized area of a surgery. So we appreciate and accept and welcome the work that is done by the doctors from all over the countries of the world coming to this place at a time when we're celebrating a very important month of OR Tambo and at a very significant and important institution named after Tata Nelson Mandela. We say thank you to Operation Smile and all the team of doctors and other volunteers who gathered here to come and provide the service and save lives and also put a smile on the children and on the families.
Thank you so much, MEC. That was MEC for Health in the Eastern Cape, Manumakusana Meth, just giving us a sense of what is actually going on here, because their lives have been changed. Children now go home smiling. Back to you, studio.
Right, Nkululeko, before we let you go quickly, I just want to know from you, perhaps, I know one of the doctor rather spoke about some of the mothers there. I don't know if you managed to get reaction from them. How are they feeling about this moment where, you know, a smile is going to be restored, a smile is going to be put back in the faces of their children? Have you managed to speak to some of them?
Yes, we haven't yet managed to speak to some of them, but I can tell you that these mothers here, they are very excited about what they are seeing from their daughters, from their sons, that their life have changed. Because you remember that when you go to the rural areas, these kids are stigmatized simply because of their condition. But now they will go home, change, because their life will be definitely changed. So mothers definitely they are very excited, but we'll get maybe some time to talk to them so that you can get a reaction from them. But definitely, for sure, they must be very excited, because we have been doing such stories in the rural part of the Eastern Cape, whereby these parents were very desperate for assistance. But today, their prayers have been answered.
Nkululeko Nyembezi is our reporter there on that story for us. Thanks very much indeed for giving us that update.